Hi YouTube. So today marks 2 weeks since my surgery. Almost 2 weeks to the minute, because I think I came out of surgery at about 11:30. Um, let's see what I'm experiencing so far. I still have some pain, obviously. The swelling, exterior swelling has gone down a lot. It's just the swelling on the palate of my mouth that, well, actually, there's still a lot of internal swelling there, obviously. It's only been 2 weeks. But the one that's bothering me the most is the swelling on the palate of my mouth, because it's what's keeping me from speaking correctly. But honestly, what I would really like to address right now is the pain that I have been having is my hip. So as you guys might remember, I had a bone graft from my hip into the top of my mouth because my jaw was short up. So my teeth, you see them now, my teeth used to be like way up here. It was so weird because you couldn't, I don't know why that happened. Anyway, but I don't know what I did a few days after my surgery. Once I get a little bit better, probably about my 6-month period, I'm going to make a little bit more of an extensive video to kind of tell you guys my situation now. But a few days after my surgery, I had to take care of my niece, and she's only 11 months. So I think in the process of like bending down to pick her up and taking care of her, the doctor said that I pulled a muscle, but the pain is not getting any better. So I'm not sure what's going on. And he said to try to walk normally, which I have been really trying. He said I can return to the gym, but only do like really lightweight, nothing too crazy, and to let him know the pain is getting worse. The pain is not getting worse, but it's also not getting any better. So I think I'm gonna really try to just let my body nurse itself back to health, and hopefully it goes away, because it's really worrying me. Like, I don't want to live the rest of my life limping. That's gonna suck. So that's that. Alright, let's talk about my face. As you can see and hear, I can speak a little bit better. I still can't open my mouth very wide, which is really annoying when I eat. Like, I could be so hungry and all I want is to just take a really big bite of something, but I can't. I have to eat really small bites of everything. I've been hearing a lot of popping on this side. I did talk to the doctor about it, and he said it's just because something to do with the muscle. And this, my bite is totally off now. Like, my teeth in the front don't touch. 2 of my molars on this side touch, and 1 on this side. That's it. So everything in my bite is just totally off. He said it was normal, not to worry about it. Trying to think what, oh, numbness. My bottom lip and my chin are still totally numb. I have been feeling like, almost like if my bottom jaw is really cold, and then I'll get like a shocking tingly feeling. So I'm really hoping that that means that I'm getting ready to get my feeling back, because one thing that I have noticed is when you kiss someone, or when I kiss my boyfriend, I can't feel the bottom part of my jaw, which is not good. Let's see, numbness up here. Yep, I'm numb here. It's very tender here, obviously, in the surgery site. The numbness up here doesn't really bother me. I still get nosebleeds. I got one at the gym the other day, as a matter of fact. I got one just last night as I bent down to pick something up, and then here it goes. But the blood is not like really bright blood. It's like a brownish color. So I don't know if it's just stuff that's up there still trying to come down. But I think it's still normal. I'm still spitting up blood. Brushing my teeth has been fairly easy because I am using a baby toothbrush, but I take my time to make sure and get in every crevice. And because I'm still numb inside of my cheeks, I can't feel if there's like a bunch of food stuck in there. So what I did is I bought a baby bulb syringe, you know, the ones that we suck the boogers out, the blue ones. And I fill it with water and I just squirt all inside of my mouth, and it is amazing. It gets all the food out of like the corners of your mouth. And I've been doing really good as far as keeping it clean and keeping all the food out of there and stuff like that. Don't know really what else to say. I'll let you guys see while you bite. It's so weird to be able to see my teeth still. But there's like quite a few gaps now, so hopefully after I'm able to get my braces adjusted, all that will be fixed. Swelling, still pretty swollen around here. And I have localized swelling, so let me see if you guys can see it. There's like a big ball right here. Right there, there's a tiny little one on this side. The doctor said that was normal as well. It's just where he extended my jaw. So my bottom jaw was extended on both sides. My top jaw was extended this way. I had a bone graft here on a missing tooth that I had. My nose, because my nose was like lopsided this way, but my jaw was facing this way, which made it almost impossible for me to breathe out of my left nostril. So he straightened out my nose and took off this hook, because my nose used to come down here from just years of my jaw being in the wrong position. It like formed that way, I guess. But other than that, that's all I got so far. I'm still trying my very best to eat regular food. Still nothing like too hard that I'm crunching on, but for example, yesterday for breakfast I had a piece of raisin bread, some oatmeal, some scrambled eggs, and for lunch I had big chicken breast, but I would like just cut off the pieces of chicken and just shove it in my mouth. And I'm trying to learn how to chew, so I am using my molars. The doctor said that was fine. He said there is enough plates and brackets and screws in my mouth. It's not going anywhere. So I am trying to teach myself how to chew again. But it is difficult because not very much can fit in my mouth, so I'm still supplementing with Ensure drinks and weight gainer drinks and protein shakes and as much as I can, because I was able to gain back about almost 5 pounds since my surgery, but it has been a struggle. And then it just gets frustrating because my face starts to ache and I get tired from eating, which should take me 10 minutes to finish. Probably takes me about 45, which is frustrating. Anyhow, if you guys have any specific questions, please ask. I will do my very best to answer them. Other than that, I will talk to you soon. Bye.